Laughing, exercising, romantic liaisons, those sound like fun activities, unless you suffer from stress incontinence. Then, those activities might sound like a nightmare.
Stress incontinence is leaking when you have any kind of pressure on your abdomen. So when you laugh, cough, sneeze. Some people have incontinence or leakage when they exercise. Some people have leakage and exercise when they lift things or switch from position from seated to standing.
Stress incontinence occurs when there is diminished function in the muscles that regulate the release of urine and support the bladder.
Usually what happens is when you laugh, cough, or sneeze, your body involuntarily closes the sphincter, which is the opening that allows the urine to come out. However, in situations where this muscle and fascia is weak, you're unable to really close that sufficiently, and therefore you leak urine.
Although stress incontinence primarily affects women, it can also affect men who have had surgeries to their prostate. Stress incontinence is common during and after pregnancy. The most damage is done during the first delivery, and it's more likely to affect women who deliver vaginally. When a patient seeks treatment, a urologist will conduct a full history and physical, including a pelvic exam. They'll also ask the patient to perform actions to prompt leakage or conduct a urodynamic test to determine the severity of the condition.
Different people have different degrees of leakages, and they can be from mild to severe. People with mild incontinence will tell me, you know, I don't leak every day. It's only when I have a really bad cold or a really bad cough, and it doesn't really bother me that much. These people usually, if they wear a pad, wear a light liner only during times that they feel like they will have leakages. And then there are people who wear multiple diapers a day. And the severity just depends on how bad your pelvic floor musculature is.
Factors that can exacerbate stress incontinence include obesity, smoking, hormonal deficiency, and any condition that might cause added pressure, such as an illness with chronic coughing. Once diagnosed, your doctor will likely recommend a combination of treatment options to strengthen the pelvic floor.
So treatment options include pelvic floor physical therapy or Kegel exercises. So Kegel exercises is just a strengthening of your pelvic floor muscles. And if you do pelvic floor physical therapy, that is a therapist helping you to figure out what those muscles are and to target those muscles in order to help strengthen them. Women, when they are pregnant, are encouraged to do Kegel exercises, which are basically exercises to strengthen the pelvic floor muscles during the time they are pregnant and during the recovery period of their pregnancy. And this may help prevent urinary incontinence in the future.
Behavioral tricks can help eliminate episodes of incontinence. Monitoring fluid consumption, restricting caffeine and alcohol, and timing scheduled bathroom breaks can reduce the likelihood that your bladder will be full during moments of added stress. Reducing risk factors such as quitting smoking or losing weight will also help. The goal of surgical interventions is either to improve the closure of the sphincter or to better support the bladder neck. The most common procedure performed is the urethral sling procedure.
And a sling is a small piece of mesh that goes underneath the urethra to hold everything up, to help keep you from leaking. It's very successful with up to about 70% of people being very satisfied with the procedure. In many cases, a patient may not leak after the procedure, but there are some people who, especially when they leak a lot prior to the procedure, it will not get them dry, but it will get them to a place where they can be a lot more comfortable with their life.
Stress incontinence can have a significant effect on lifestyle. Sufferers may withdraw socially or become depressed because they're so embarrassed by their condition. We're here to tell you that there's hope. Stress incontinence is a common condition that can be effectively managed and treated. There's no amount of leaking that is too little to discuss. If you're having difficulties and it bothers you, talk to your doctor about treatment. I'm Dr. Mike Rosen, and you're watching the eHealth Network. See you next time.